So I think because of this, that what I felt during my journey as a as a hematologist who's trying to survive practicing benign hematology or non-cancer blood disorders. So with a very kind of enthusiastic resident that I met, we decided to do to show it with numbers, because I was always told by my mentors that numbers talks. You have to talk numbers for people so that they pay attention. So then we decided to, because even this resident also felt during her training that how, there is a discrimination between patients who have non-cancer blood disorder and patients who have cancer. There's much more resources provided to focus on cancer, and then these chronic diseases that people grow up with is forgotten. And we forget that how much a chronic disease can affect quality of life. It affects your job. It affects your everything. Because you grow up with this, you're supposed to handle a complex disease and also be an active person in the society. Keep your job. Don't lose too many days of work, and then you lose your job, right? So if it's not a well-shaped practice taking care of this benign hematology cases. So then we decided, okay, I had a new clinic here at the University of California, Irvine, Chao Cancer Center, Chao Family Cancer Center. So we decided to just analyze my patient clinic because I practice full-time only. I see non-cancer blood disorders. So we showed that, between just 2 years, between 2020 and I think 2023, I saw about 700 patients, which might be an underestimation because we excluded all the people who were working at UCI, and they had this glass brick for privacy. So it's kind of probably I saw about 1,000 patients, but we analyzed only 700 patients at the time of writing this abstract. And we showed that out of these 700 patients, about 20% of these patients were referred to me from other hematology oncology colleagues. So that shows that there is a big need. 20% of these patients were referred. And this is only patients that I saw. And then, all of our other hematologists in our cancer center, they also have to see benign hematology patients because otherwise I'm only one full-time benign hematologist, so I won't be able to see everybody. So then they are being turned away. So they are being seen too. So this is only one clinic, 700 patients over 2 years, about 1,000 patients, I would say, over 2 years. And this was during pandemic. Right. So at some point I saw, okay, patients are not coming to clinic because of the pandemic. So we switched to complete video visits. So despite video visits and pandemic and all these things, 20% was from hematology oncology, another 20% was from our internal medicine, another 20% from our family medicine, and then the rest was from like 30 different subspecialties. So this just shows that how there is such a big need for this having a benign hematologist added to the to all of our hematology department. Also, the other thing that in my opinion, points out here is that I had patients from Sacramento, right, in North or San Francisco area to south in Murrieta area. So it's kind of like long coverage area, right? So that also shows. And then, some of my patients would move to Northern California and I would tell them, okay, go to this facility, but they were not satisfied. So they wouldn't switch, provider. They would want to stay with me. So they would continue video visits. Right. So because they didn't feel like, seeing an oncologist, hematologist was as good as seeing just a somebody who only does this for a living. So I think these were the major findings of this study.